I am a little bit quizzical right now. I did research the discoloration on my front back lower gums in the four front teeth, but only two of them have the discoloration. However, that discoloration is it's green. It's green and it's scaring me. It really is scaring me. And so I looked it up and I found out this is coming from a girl who doesn't want any tattoos, okay? It's called amalgam tattoo. That's what it's called. And you know how you get it? Yeah, well, listen to this. So you know I had an amalgam filling on my second molar, right? And it would be on the left-hand side, right, of my mouth on the top, right? So they pulled the whole tooth out. Well, and I, for years, have been saying that filling is leaking. I know it's leaking. That tooth feels odd. I have pain every time I chew on that side. Just weird shit, right? So I got the whole tooth pulled out. And when I spoke to the dentist, before I went to see this one particular dentist, I had gone to a few before, and I asked them about that filling, and they said, no, the filling's in there good. It's not leaking. It's solid. The tooth is solid, right? Okay. I got the tooth pulled right out, right? And in that process, I felt no pain, there was no bleeding, there was nothing, right? However, a couple of days after, I noticed some discoloration here on the teeth, not the gum, the teeth. And I looked it up and it said, yeah, that discoloration will go away in a couple of days. And it did. The discoloration on the side went away. However, I bought one of those dental, with the pick and the little mirror, and I went inside my mouth and looked because I wanted to clean the tartar off my teeth. So I went and I looked at the back of my four front teeth here that I'm having problems with. And there was a spot on the gum that is green. Yeah, it's green. It looks like gangrene. I've worked in a semblance of healthcare, and so I know what gangrene looks like. And that, it looks identical to gangrene, so I was scared. So I came home, well, didn't come home, I looked it up. I went on the internet and I looked it up. And I found out that it's called a amalgam tattoo. Yeah, and it doesn't go away. It doesn't go away. It's there for as long as it's there. I mean, it does say that there is a treatment for it. It does say not to pick at it with the toothpicks, which nobody told me. I had no idea. I was going to clean it out. I thought, that's just a pocket of fluid. I'll clean it out. No, because if you put a hole in it, you can get an infection. It can bleed into your system. You get very, very sick. So it's not to be done unless done by a dentist. So I got to go back to the dentist. But I want you to hear what it is. Now, I did look it up, and it did say that it could be from bacteria. But because I had an amalgam filling, I'm fairly certain it's from that silver filling. Now listen what it says. And here it is right here. Okay? An amalgam tattoo is a flat, dark, blue-gray or black spot on the mucous membranes of the mouth, most commonly on the gums near a silver-colored filling. Okay? The gums are here in behind and the tooth is here. Yeah. So tell me that amalgam filling wasn't leaking into the gum. Yeah, tell me that. Just tell me that, right? And it does say that the reason you get a lot of tartar behind those front teeth is because that's where the salivatory glands are. Salivatory, where the saliva is. You get a lot of saliva that develops there, and so it forms a lot of tartar. Now listen. Here's my feeling on this, right? So if the filling was here, I got it pulled out, it was already leaking into my jaw, right? I think it leaked right through into my jaw because I had discoloration here. I never had the discoloration like 9 years ago. Didn't have it. Didn't happen. Anyhow, now I don't have any on my gum line here, but I do have it here. So I've been doing the oregano mouthwash, and it's not lightening or anything. It's just staying exactly the same, and it does say it's a lifetime thing, right? It'll be there. Now, it's normally on the gums near a silver filling, a mercury filling, okay? That's not that close. I mean, it's here to here, right? So it would have had to come through my gums to get into my salivatory or saliva. salivary glands. I can't pronounce it. Anyway, you know what I mean. Okay, so I looked up the causes, and this is what it says. Accidental, that's what I think, embedding. Tiny metallic particles from dental amalgam, an alloy of silver, mercury, tin, and copper, get trapped in the soft tissues of the mouth. That's what I think happened. So a common dental procedure. So this can happen during filling placement, filling removal, which is what I had done, tooth extractions, root end surgery, which is called an apicodectomy, or when flossing right after an amalgam filling is placed. Healing. The gum tissue heals over these microscopic metal fragments, trapping them permanently. Damn it! Yeah. So the key characteristics, it says, and this is what I'm reading right off the internet, okay? It says, harmless. It is a completely benign, painless, and does not pose any health or medical risk. You're telling me that I have metal tracings in my gum and that it doesn't pose a risk? What the hell? Like, really, I'm not that stupid, are you? I just don't get this. I don't get this. Sorry, I put myself. Okay, so it says it's permanent, okay? The spot doesn't change in size or color and cannot be washed away or rubbed away. Yeah, so it's permanent. It won't change in size or color over time, and it cannot be washed or rubbed away. Diagnoses, okay? It says dentists can usually identify it visually by its location near a metal filling or confirm it using a dental x-ray, which often shows tiny, bright white, radio opaque metal specks in the tissue. Treatment. I have to put this a little higher, sorry. So treatment. And I'm reading it right off the internet. No treatment needed. Because the condition is purely cosmetic, medical treatment is generally unnecessary. Removal options. If the spot bothers you for aesthetic reasons, a dentist or a specialist can remove it using specialized laser therapy or surgical grafting, though this is rare. Important distinction. Dentists check these spots, okay, to make sure they are not dangerous pigmented lesions such as oral melanoma. And I do have cancer. I have skin cancer when I have also had melanomas, okay? If a dark spot grows, hurts, bleeds, or has irregular borders, a biopsy is done to rule out serious conditions. Jeez. Like, and it's called an amalgam tattoo. Like, coming from a girl who's never had a tattoo in her life and don't plan on getting any soon, now I got to contend with this. So I got to make a dentist appointment and see what kind of treatment they can give for me. Yeah, it doesn't hurt, but I'm not risking it. I want it out. So I'll see you in the next video. And if there's any spots on your body that you don't recognize, be damned. Go and get them checked. Don't play with your life, okay? Our life is too short as it is. So I shall see you in the next video. And I will have an update, hopefully, on my gum. Bye-bye.